Next is the CEO's report. Kandice?
Clinic, I think Dr. Kinsey would agree, has been very busy. They've been swamped with new patients as well. Casey's seen a lot of new patients, and again, thankful to have Jill there helping us with upfront collections and just kind of the clinic flow, getting them into a group of getting their paperwork completed and moving on to the next patient, and it has really helped, I think, them, the practitioner, as well as the clinic, being able to get step to billing much quicker. So thank you, Jill, for that. Wound care clinic keeps growing. It really has, and Dr. Kinsey and Regina have done a great job at that. We appreciate that. As you can see, lots of volunteer hours for 2012. Janet, what month did you start volunteer services? I know Home Health had done it for quite some time, in August. So next year we can expect to see a lot more of that as well. The Morale Boosters put on a very nice Christmas party for the staff down at the Moose Lodge, and I heard a lot of employees comment that that was the most fun they'd had at a shared Christmas party, so that was nice to hear. They also adopted 2 families over the holidays, and we collected toys and clothes for the families and gave those near Christmas. I can't tell you what an incredible response. This room was packed with toys and clothes. It was crazy. It was wonderful, and that was all our staff. So that was really neat to see. We had our annual insurance enrollment, and just to give you a little bit of idea what went on, our insurance premiums came back $130,000 higher, the quote, than last year. And refresh your memory, last year we had a $45,000 increase that share absorbed. We did not pass any of that along to the staff because we were in the, we had cut their hours and we just didn't feel that we could do that. But with a $130,000 increase, what we decided to do was to increase the deductible to $5,000 and not have to pass along a huge increase in premium. And just a reminder, all employees do get a 50% discount for services rendered at share, except in the physicians' clinics. Those are not discounted at 50%. So we try to encourage that and to help out in that way. But that's just kind of, where insurance is going is as a catastrophic coverage instead of just your day-to-day taking care of your physician visits. So that's a pretty big hit. We are also looking at, we have an ADP rep coming next Wednesday, I believe, because I'll be gone, to look at our software system and make recommendations for upgrades. You can see how many people we process in the matter of, I guess that was a couple of months. It's a lot of paperwork to keep up with, and the federal government is going to be requiring more reporting from us to them, and so we are going to look to upgrade our ADP software to include some HR stuff as well, and to help assist with that reporting. So we're looking forward to that. You can see the new employees that we've hired. Got a couple of pieces of new equipment in the lab, a new microscope and a new eye staff. EHR report. We now have materials management and accounts payable that went live January 2nd. Chris has to run meaningful use reports, and he said they're looking better every day. Those reports kind of track the status of staff answering the questions appropriately, moving forward. through the software, and this helps pinpoint where more training is needed or software tweaking needs to be done. And he said that's going well, so it's good to hear. Dr. Kinsey has been participating with Chris for the physician documentation module that will go live in June, I believe, June or July. So that's moving forward as well.
Somewhere along those lines.
Seems like a J month.
We know it's not this
January.
month, so no, surprise, we're not ready for that yet. But we had some employees also hold a couple of fundraisers for the food pantry, and they raised $512, which was also matched by the Woods County Coalition. So that was a nice thing to give back to the community. Later on this month, the nursing staff will complete their stroke education, and that's provided by Angela Williams, the stroke coordinator at St. Anthony's. Kelly Heller, our surgical supervisor, resigned effective January 11th. Patsy John Grasso has accepted that position. She was a nurse that was on staff with us. She came on in November, and she has 13 years of surgical experience at level 1 and 2 trauma centers. So we feel very fortunate to have had her on staff. Literally, we talked to her on Wednesday. She accepted the job at 7 a.m. Thursday morning. She was in surgery, following surgery staff around to get oriented. She was able to go to Dr. Hummel's clinic the next Monday, learn that process. So very blessed to have that kind of knowledge on staff and step in there and not miss a beat in surgery. It's going very smooth. I talked to Dr. Ransom. He's pleased with the transition as well as the staff. So good deal. Tanya McClary, Kelly was also the assistant director of nursing, helped Regina out. So with her resignation, Tanya McClary, which is our ER supervisor, has also taken on the assistant director of nursing. So we're glad to have her do that. One other thing that I want to mention is Cimarron Insurance is their liability insurance. There had been some talk that we would look for a company to purchase that RRG, and come down to the end of the year and weren't comfortable really with what was brought to the table. So the group made the decision to stay together through 2013, and at the end of 2013, that company, that RRG, will dissolve. And at that time, we will be able to go out and purchase insurance on our own for liability. It just got to the point where the market is very competitive, and what we needed for premiums was above, what the market was offering, and so we weren't able to recruit new hospitals, which made our administrative costs too high. So it makes sense. So we're going to knock on wood. We have a good 2013 and can go out looking for insurance on our own.
That's not a bad deal, though.
No,
I mean,
it's a good thing.
yeah, we could stand to save quite a bit of money on our premiums, and if there's no.
This year, our premium is going to be about $77,000. Without going into a big long explanation, that kind of comes out of our own high. But in comparison to last year, our premium was $220,000. So that's kind of where we're at. Does anybody have any questions for me?
No? Thank you. Appreciate it.